posted a video earlier today on my page, and it had to do with a patient. This is what happened to this patient. This patient is one of these men that harvest palm fruit. So he went to harvest palm fruit, and in the process of harvesting the palm fruit, particles from the palm fruit or the palm frond entered his right eye, and with the discomfort he couldn't continue, so he came down from the palm tree. He started rubbing the eyes. While he was rubbing the eye, there was tearing and redness of the right eye. Next day, noticed that the right eye was still reddish with mild pain. A friend of his told him to use a particular leaf water to instill in the affected eye, which he did. What you're seeing at the screen now is the end product of their self-medication. Now, this is the implication of what he did. This man unknowingly rubbed a particle against the cornea. Now, the cornea of the eye is a layer of the eye that contributes about 40% to vision. And the cornea is very sensitive. That is why sometimes if you're having your bath and soap enters your eye, that sharp pain you're feeling that pain around the cornea. And it is transparent in nature. Anything that alters the transparency of this cornea absolutely affects vision. So because he rubbed a particle against the cornea, unknowingly to him, he caused a micro tear on the cornea and also instilled a corrosive liquid in the eye. What I mean by corrosive is something that is harsh. Now, leaf water that he applied in the eyes caused the micro tearing on the cornea to spread. This gave room for bacteria to invade the affected eye, leading to inflammation and pus in the eyes, which is medically known as hypopion corneal ulcer. In a more severe case, this can lead to panophthalmitis, and this is what happened to this man. In panophthalmitis, there is inflammation of the whole globe. This condition is usually associated with loss of vision. In this case, the doctor is only going to manage the pain, the bacterial infection, and the redness of the eye, which are the symptoms of this panophthalmitis. But vision in that eye will be lost, meaning that the person will not be able to see with the affected eye. If the person is lucky and the person's case is hypopion corneal ulcer, now this can be managed, but it will leave the patient with a scar on the cornea. Depending on the area of this corneal scar, if it is on some part of the cornea, the person can manageably see with the affected eye. But if the scar is located on every part of the cornea, it means that the person will not be able to see with the affected eye unless he or she will go for cornea transplant. And I am very much aware that cornea transplant is not for the poor and is rarely done in Nigeria. Now, what are you supposed to do to avoid this kind of problem? What you're supposed to do is go to my YouTube channel, go and watch the video I made on dangers of rubbing your eyes. This will help you to be conscious of what you are doing or putting in your eyes. I hope this was helpful. Shalom.